Hello guys, today we will study about dorsum of hand. So the dorsum of hand layout consists of extensor retinaculum, dorsal digital expansion, anatomical snuff box, arrangements and insertion of extensor tendons on dorsum of hand. So we see that the skin on the dorsal surface is thin, whereas the skin on our palmar surface is thick. On cutaneous nerve supply, we see that ulnar nerve supplies the median 1.5 palmar area of our hand, whereas the lateral 3.5 area is supplied, 3.5 palmar area of our hand is supplied by median nerve. And the superficial branch of radial nerve supplies lateral 3.5 dorsal surface of our hand, and ulnar nerve supplies 1.5 dorsal surface of our hand. So this is the cutaneous nerve supply of our hand. So first of all, we will go through extensor retinaculum. Extensor retinaculum is a thickening of deep fascia that stretches across back of wrist and holds long extensor tendons in position. It converts groove on the posterior surface of the distal end of radius and ulna into six separate tunnels for the passage of the long extensor tendon. The tunnels are separated from one another by fibrous septa that pass from the deep surface of the retinaculum to the bones. Retinaculum is attached medially to the pisiform bone and hook of hamate and laterally to the distal end of radius. The upper and lower borders of retinaculum are continuous with the deep fascia of forearm and hand. So in this diagram we can see this is extensor retinaculum shown here. It is attached medially to the pisiform bone and hook of hamate, and on the lateral side is it attached with the distal end of radius. And so it provides a passageway, or it holds the extensor tendons in position. So in this diagram, this is the cross section. We can see extensor retinaculum is present here, and the tendons of extensor indicis and extensor digitorum are present beneath the extensor retinaculum. Now we will go through the dorsal venous arch. The dorsal venous arch lies in the subcutaneous tissue proximal to the metacarpophalangeal joints, and it drains on the lateral side into the cephalic vein, lateral side into the cephalic vein, and on the medial side into the basilic vein. The greater part of blood from the whole hand drains into the arch, which receive digital veins and freely communicates with the deep veins of the palm through the interosseous spaces. So in this diagram we can see here is the formation of dorsal venous network, and it receive finger veins from above, and then it continues into the cephalic vein and basilic vein. So this is the dorsal venous arch. Now we will study about dorsal digital expansion. The dorsal extensor expansion receives the tendon of insertion of the corresponding interosseous muscle on each side, and further distally receives the tendon of the lumbrical muscle on the lateral side. The four tendons of the extensor digitorum emerge from under the extensor retinaculum and fan out over the dorsum of the hand. The tendons are embedded in deep fascia, and together they form roof of the superficial space, which occupies the whole width of the dorsum of the hand. Strong oblique fibrous band connect the tendons to the little ring and middle finger proximal to the heads of the metacarpal bones. The tendon to the index finger is joined on its medial side by the tendon of the extensor indicis, and the tendon to the little finger is joined on its medial side by the two tendons of the extensor digiti minimi. So this is the extensor expansion. The two lateral bands come here, and the middle band ends here. So this is the tendon of the extensor digitorum muscle. In this diagram, we can also see the extensor expansion formed here. This is extensor root. Now we will study about anatomical snuff box. It is a skin depression that lies distal to the styloid process of radius. It is bounded medially by the tendon of extensor pollicis longus, laterally by the tendons of abductor pollicis longus and extensor pollicis brevis. The radial artery can be palpated within the snuff box as the radial artery winds around the lateral margin of the wrist to reach the dorsum of the hand. So radial artery can be palpated here. So in this diagram we can see here is the formation of anatomical snuff box. The radial artery can be palpated here. Now we study about dorsal interossei muscles. Here we can see this is the first dorsal interossei muscle, and second, third, fourth, fifth, and they are involved in abduction and adduction. So the dorsal interossei, their origin is from the continuous side of the shaft of the metacarpal bones, and their insertion is in the proximal phalanges of index, middle, and ring finger and dorsal extensor expansion. It is supplied by the deep branch of ulnar nerve, and the nerve root is C8 and T10. Dorsal interossei abduct finger from center of the third finger, both palmar and dorsal flex metacarpophalangeal joint and extend interphalangeal joints. Now we will study about the blood vessels on the dorsum of hand. So we see that radial artery is present here, and it then give metacarpal arteries and further digital arteries. So the radial artery, on reaching the dorsum of the hand, the artery descends beneath the tendon of the extensor pollicis longus to reach the interval between the two heads of the first dorsal interosseous muscle. Here the artery turns forward to enter the palm of the hand. So here we can see that radial artery, reaching the dorsum of the hand, it descends beneath the tendon of the extensor pollicis longus muscle. It descends beneath the tendon of the extensor pollicis longus muscle to reach the interval between the two heads of the first dorsal interossei muscle. Here the artery turns forward, and from here the arteries reach the palmar side of the hand. Branches of the radial artery on the dorsum of the hand take part in an anastomosis around the wrist joint. Dorsal digital arteries pass through the thumb and index finger. Clinical correlates. Mallet finger. Evasion of the insertion of one of the extensor tendon into the distal phalanges can occur if the distal phalanx is forcibly flexed when the extensor tendon is taut, resulting in a condition known as mallet finger. And the second deformity is Butner's deformity. It is that avulsion of the central slip of the extensor tendon proximal to its insertion into the base of the middle phalanx results in a characteristic deformity. The deformity results from flexing of the proximal interphalangeal joint and hyperextension of the distal interphalangeal joint. So these two are the clinical correlates of for the dorsum of hand. So in this diagram we can see mallet finger, and so thank you very much. Please subscribe my channel.